welcome to the show Social Security, Securing Today and Tomorrow. I am Diana Varela, your host, and I am very glad that you are able to join us tonight for a show that will provide you a lot of information about your benefits. And today it's all about Medicare. For that, I have a very special guest, David Santana, who is a health insurance specialist and the lead training at the National Training Program Division in the Office of Communications for the Centers for Medicare and Medicaid Services. David, welcome.
Thank you, Diana. Great to be here.
And thank you so much for accepting our invitations, because I know that being the lead trainer in the National Training Division, your schedule is very busy. Tell us a little bit more about what you do.
It is very busy. As you mentioned, I work for the Centers for Medicare and Medicaid Services, which is the federal agency that administers the Medicare program, the Medicaid, Children Health Insurance Program, as well as the health insurance, private health insurance marketplaces. We are one of the agencies under the Department of Health and Human Services. The group that I work for is the National Training Program under CMS Office of Communication. And one of the things that we do is to write training curriculums to teach people who assist people with Medicare making an informed choice about their healthcare benefits.
Great. Well, it's really great to have you here, because our community also needs to have that important information, David, and we will be talking about all of the different benefits that your agency administers, but today we are going to concentrate on Medicare. And of course, tell us, what is Medicare?
So Medicare is a federal health insurance program for three groups of individuals. The first group is those who are 65 years of age and over, those who are under 65 and receiving Social Security disability benefits for 2 years. And the last group is that individuals at any age who develop end-stage renal disease, which is kidney failure that require either kidney dialysis or kidney transplant to maintain life. So in addition to that, to qualify for Medicare, you also have to be legally residing in the U.S. and also be here for at least 5 years.
Okay, great. And we always talk, in regards to health insurance, most workers are familiar because most employers provide health insurance. Basically, Medicare is the national health insurance. But what is a little bit different about Medicare and other health insurance is that Medicare is divided in different parts, right?
Exactly. And I think that is where people get a little confused about Medicare.
Yes.
So I think the best way that we can go about explaining people the structure of Medicare is to think about if they ever had health insurance through an employer or otherwise. There's typically healthcare settings where you receive the care. You go to a hospital, you go to a doctor to receive services outside of the hospital. And also, you typically go to a pharmacist to get prescription drug, because usually when you came out of the hospital or you see the doctor, if there is a medical condition, you came out of there with a plan of care, which usually require prescription drugs. So you move in between those three settings, right? Hospital, doctors, pharmacist. That is Medicare, actually. Those are the parts of Medicare. So. Hospital is Medicare Part A. That's the part that pays when the individual becomes an inpatient in the hospital. Now, when the individual receives professional care outside of the hospital, which is going to see the doctor, laboratory services, outpatient care, durable medical equipment, home health care, all of those other things are covered under Medicare Part B. And then, of course, when you go to the pharmacies, drugs equates to Medicare Part D. So you have Part A hospital, Part B, the medical insurance, and then Part D, which is prescription drug benefits. So those are the three parts of Medicare when you move from setting to setting. That's what it means.
Exactly. But there are also different options in regards to the coverage that you can get in Medicare, right?
Exactly. So people in Medicare do have healthcare coverage choices and how they wanted to get their healthcare coverage. So the first is what we call the original Medicare. So that's, I just finished explaining the parts of Medicare. So what is original Medicare? Original Medicare is Part A, hospital insurance, and Medicare Part B, medical insurance, right? That's what we call original Medicare. Now, people have the option of enrolling in hospital insurance and medical insurance and have hospital and coverage outside of the hospital. If they stayed in that option, as you mentioned, there are people who have, for example, employer group health plan while they're actively working, and oftentimes they could take that employer plan into retirement. So they keep that employer plan going. In that case, for example, after you retire, typically employers will require you to enroll in Medicare Part A and B, and then they become a sort of a supplemental plan. So they wrapped around Medicare to pay what Medicare doesn't pay for, and that includes prescription drugs. So usually you have Medicare Part A, Part B, you have employer plan, and it wraps around Medicare. Many people also have in this area, for example, they are federal employees and retirees. They can take that into retirement. If you have that on Medicare, you're covered. You will stay typically on the original Medicare tract. There are individuals who qualify also for Medicaid. That is the state program for individuals and family who have limited income and resources. So if you are already enrolled in Medicaid and you age into Medicare, typically you will stay in that original Medicare track, Part A, Part B, and then you have your Medicaid coverage, and you typically will be required to enroll in a Medicare Part D plan, which is a private company that sells coverage to pay for your prescription drugs when you go to the pharmacy. That is because original Medicare, Medicare Part B typically don't pay for outpatient prescription drug benefits. They only have a very limited coverage for prescription drugs under Medicare Part B, and that's limited to immunosuppressant drugs and some cancer medications. But in general, you would need to buy a separate private plan that will pay for prescription drugs. So that is one option. What's the next option? So Congress allowed people in Medicare to enroll in private plans and have a private company administer their health insurance. Those companies are approved by Medicare. So if you are enrolled in Medicare Part A and Medicare Part B, you have the option to enroll in a private plan. Those plans are called Medicare Advantage plans, and some people even remember those plans as Medicare Part C. So how does the plan works if you go that route? So those plan bundles hospital, medical, and the majority of the plans will have a prescription drug plan. So you would have only one card that you would use when you go to the hospital, when you go to the doctors, and also when you get your drugs at the pharmacy. So those are kind of like the main two coverage options that people in Medicare have.
Yeah, and it's great because it's a lot of information, and of course, you know, you will have to make decisions whether the original plan of Medicare is better for you or even one of the Medicare Advantage plans. So that is the reason why we have these programs, and we invite you to visit the Medicare website, medicare.gov, to get this information, David, ahead of time. So that way, when you are about to make the decision, you make the right decision for you. I see. And then, David, in regards to the different parts of Medicare, there is a cost for some of the parts. Can you tell us about the cost of Medicare, please?
There is a cost. You are correct, Diana. Whenever we think about health insurance, regardless whether it's Medicare or any other type of private health insurance, or even if you get homeowners insurance or auto insurance, there is typically a cost, and that's a premium cost. You typically pay a monthly premium. So I mentioned about the parts of Medicare and the different settings when you move from setting to setting, which part of Medicare pays for. So we began with Medicare Part A, which is a hospital insurance. Now, anyone who works, when you look at your receipt, you will see a Medicare tax on your W-2 forms that you get from your employer. If you work for someone else, you typically pay a Medicare tax. That's about 1.45%, and your employer paid 1.45%. That's 2.90%, and if you are self-employed, you pay 2.90. So that's a Medicare tax. So if you did pay your Medicare tax, typically 10 years, you work for Social Security. When you accumulate 40 working credit in a 10-year span, you qualify for premium-free Medicare Part A. So 99.9% of people that turn 65 and qualify for Medicare get Medicare Part A without having to pay a premium. So it's a premium-free Medicare Part A when you turn 65. Again, if you have the required amount of working credit, or if you are married with someone who has the required amount of working credit, and I'm sure Social Security can expand on that. So that is Medicare Part A. However, there is a small amount of individuals that do not qualify for premium-free Part A because they did not have the working credit required to get it. So those individuals can buy Medicare Part A when they turn 65.
Exactly. And there are some requirements for those individuals that can purchase Medicare Part A. And we are going to tell our viewers, now we have to go to a short break, but stay with us because we would like to provide you with more information about Medicare benefits. And today that we have the expert, David Santana, is the best opportunity that you have to get the information that you need to make the right decisions about your benefits. We'll be right back.
Social Security is with you through life's journey from birth to retirement. As your life changes year to year, so do your needs. For over 80 years, Social Security has helped to meet your needs and is committed to improving access to the services that make a difference in your life. Today, you can verify your earnings, estimate your future benefits, apply for retirement, manage your benefits, and even change your address, all from the comfort of your home. Social Security's online services help put you in control with secure access to your information anytime, anywhere, allowing you to spend more time with family, friends, or simply just enjoying the day. Social Security, securing today and tomorrow. See what you can do online at socialsecurity.gov.
Produced at U.S. taxpayer expense.
Thank you. Welcome back again, and we really appreciate that you are staying with us because we want to provide you with important information, and today we're talking about Medicare. So David was talking to us about the cost of Medicare. We talk about the Part A that will be premium-free for people who have their 40 work credits. They've been paying into the Social Security system. You also talk about a group of beneficiaries that can get the benefits with the specific requirements even if they have no work, David.
Exactly. So if people don't have the required amount of working credit, or they're not married to someone who has the credits, they can buy Medicare Part A. Medicare Part A premium this year is $437 a month. So if they do want to buy Medicare, they would have to do so and pay the premium. What we often hear is that individuals that do not have the required amount of working credit is because they typically have limited income and resources. So this is a kind of a good segue to talk a little bit about help.
Yes.
Specifically, if an individual think that they have limited income and resources and they cannot afford these high premium for hospital insurance. So states have programs that is called Medicare Savings Program that are designed to help people who have limited income and resources, for example, to pay for Medicare Part A premium and also out-of-pocket costs when you receive those services. So I mention this because I know the majority of individuals, when they hear the premiums, go, wow, that's a little high to be able to afford that premium, especially if you don't have the working history here in the U.S. Now let's talk about Part B.
Yes.
So we don't pay taxes for Part B. Nobody really gets Medicare Part B for free. So everyone would have to pay a premium. If someone is not paying the premium, it's because someone else is paying on their behalf. Going back to what I just mentioned about Medicare Part A, states have programs called Medicare Savings Program that would help individuals who cannot afford the Medicare Part B premium, the Medicare Part A premium as well. So how much is the Medicare Part B premium? This year is $135.50 for the majority of people. About 94% of people in Medicare will pay what we call the Medicare Part B base premium. However, the Medicare Part B premium in general is based on your income. So you could be paying anywhere from $135.50 base premium to $460.50 based on your income. So if you make more than $87,000 as a single tax filer or more than $170,000 as a joint tax filer, you would usually pay more than $135.50. Again, up to $460.50 a month. How would you know? When you apply for Medicare, Social Security will send you a letter if you are above those income thresholds, and it'll let you know that they got that information from the IRS, and it'll have explanation there indicating that if that's not your situation, if your income is not what the IRS says it is, they have resources. They can contact Social Security and work with Social Security to make sure that they're paying the right premium.
Correct. And especially because we are taking a look at the beneficiary's income 2 years before. So in a lot of cases, 2 years before, maybe the person was still working, David.
Exactly.
And therefore, there is what we call a life-changing event, which is a life event in which your income has decreased. And you can always contact us. But you mentioned something, we will always send a letter. And the person will know ahead of time what we are planning to do with the benefits. And at the same time, we tell them what to do if that is not the present situation.
Exactly.
That is great. And it's good, for people to know that ahead of time because they can prepare. And also for those that have lower income and resources, that need assistance with the payment of Medicare and Medicaid, that they can be eligible for Medicaid, they can just call 311 in Montgomery County. So that call routes to social services where they can apply for those Medicare savings programs. And also Social Security offers extra help because the prescription programs also have premiums, deductibles, and copays, right? So, but people can apply for that extra help with us. But tell us a little bit more about the prescription plan cost.
Right. So we mentioned that individuals who don't have other form of health insurance that would pay for prescription drugs can purchase a private plan. That could be through a Medicare Advantage plan, as I mentioned, that typically come with prescription drugs, or they can buy a standalone prescription drug plan. So the typical the average premium for a Part D plan is about $32 a month. So it's not that much. Typically, the program is designed to pay about 75% of the cost of the drugs, and the individual is required to pay about 25% of the cost of the drugs. That's kind of like in general how the Medicare Part D program operates. But as you mentioned, if you do have limited income and resources, you can apply through Social Security, contact Social Security, fill out an application to see if you qualify for extra help. If you do, depend on what your income is, you may not have premium at all, it's maybe zero premium, and you may have very little out-of-pocket expenses when you go and get the prescription drugs at the pharmacy counter.
Exactly, and I invite you to visit us online, socialsecurity.gov, and in the search engine, you just type extra help, and we will provide you with information about those other benefits that can help you pay for the cost of Medicare. But now, David, probably you get this question as much as we get the question when it comes to Social Security benefits: when is the best time to file for benefits? When can somebody file for Medicare? When is the best time to file?
Exactly. So with Medicare, we have what we call enrollment periods. You have to come into Medicare during certain times. So the initial time to join Medicare is around your 65th birthday. So we have like 7-month window that individuals can apply for Medicare during that initial enrollment. 3 months before their birthday, the month of their birthday, and 3 months after their birthday. That is the first opportunity to come and join Medicare. If you applied 3 months before your birthday, then the first date of that month of your birthday will be your effective date. If you apply thereafter, it may be a little delayed before Medicare kicks in. But those are the 7-month initial enrollment period to join Medicare. Many individuals, as you mentioned in the beginning, are working beyond 65, and they do have employer-based coverage based on themselves or their spouse who is still working. So if you do have an employer group health plan based on current employment, either through self or spouse, you fall in what we call a special enrollment period. So that means that when you turn 65, you don't have to enroll in Medicare during that initial enrollment period because you qualify for special enrollment period. Special enrollment period lasts for as long as you're actively working. That means for as long as you're actively working and covered by that plan, you can sign up at any time for Medicare. After you retire, then you have 8 months from starting the month after you retire to sign up for Medicare. If you don't do it during that time frame, there could be late enrollment penalties if you don't enroll during your initial enrollment period or you don't enroll during your special enrollment period. But people ask, so what happens if I don't enroll during those 2 periods? You can always enroll in Medicare every year during the general enrollment. That is from January 1st through the end of March. So every year you can come in and join Medicare during that time period if you didn't do it during your initial or special enrollment period. The only thing is, as I mentioned, that there is a late enrollment penalty if you do enroll in Medicare late. You didn't enroll during that initial or a special enrollment, you could be penalized for late enrollment. That penalty will last for as long as you are enrolled in Medicare, so it never goes away. The Medicare Part B penalty.
Yeah, and once again, as we have learned when we talk about retirement, it is for some workers best to file for benefits at the age of 62. For some others, it's best to wait until they're 70. You can file in between. It's the same with Medicare. We cannot advise you which enrollment period is the best for you. And that is why we invite you to visit us online, get the information that you need so you can make the right decision. You can visit either Medicare.gov or socialsecurity.gov. And once a person makes the decision, well, it is best for me to enroll now that I am turning 65 years old during my initial enrollment period. How can they file for for Medicare benefits?
So that's a great question. We did not mention. I'm glad that you mentioned the fact that individuals can apply for retirement benefits as early as age 62, because if you apply for retirement benefits before you turn 65, Medicare will come in automatically. So nothing you need to do, because Social Security already have your records. You apply for retirement benefits before you turn 65. That information will be transferred to our agency, and we will send a Welcome to Medicare package along with the Medicare card. But this is the only group that automatically gets enrolled in Medicare, or, as I mentioned in the beginning, those who apply for Social Security disability benefits and are found qualified. If you're getting Social Security cash benefits for 2 years, you will get automatically enrolled in Medicare after you've been in Social Security disability benefits if you're not 65 yet. So those are the two group of individuals who will get automatically enrolled in Medicare. For those who are not automatically enrolled in Medicare, then you have to come in during those enrollment periods. How can you sign up for Medicare? I tell individuals that Social Security is the gate to Medicare. So you are our partners. You enroll people in Medicare, and once they enroll, then you transfer their file to our agency, the Centers for Medicare and Medicaid Services. So maybe you can elaborate on the process of enrollment through Social Security better than me.
Of course, David. Throughout these programs, we have been advising workers that the best way to contact Social Security Administration to either file for retirement or for Medicare is going online, socialsecurity.gov. And we even have the Medicare only application. If at this time you only want to file for Medicare and defer your retirement benefits, you can just file for Medicare, and we advise workers to do that 3 months before you want your Medicare to start. You can also visit Medicare's website, and that is the reason, David, that we would like to invite you to another program, and I hope that you accept our invitation. But one last word of advice to our viewers.
I would like to advise everyone to make sure that they pay attention to these enrollment periods, because as I mentioned, we didn't go in great details about the penalty. We just mentioned that there was a penalty. So the question is, what is the penalty?
Of course.
So make sure that you apply during these time frames. And if you have questions, go to our website, medicare.gov website, call 1-800-MEDICARE, 1-800-633-4227 if you have any question. Call Social Security. Don't wait for things to happen. Just call proactively and ask questions in terms of when should I enroll in Medicare, what's the process. So you make sure that you make the right decision at the right time.
Yes. David, thank you for your time. Thank you for your time, and stay tuned, because David will come back with more information about your Medicare benefits. Until the next time.